There is anecdotal evidence of irrigation-related adverse event and complication after spinal endoscopy in patients with incidental durotomy. The growing number of endoscopic spine surgery procedure also increase awareness of its potential pitfalls and procedures. This team of investigators suspected that the rate of unrecognized durotomy is higher than 1% rate previously reported, stipulating the intradural spread of irrigation fluid caused the observer hypertensive episode, seizure, neurological deficit, and Caudequina syndrome, or could be responsible for milder symptoms including spinal headache and neck pain, suggestive of unrecognized smaller durotomy. Furthermore, the author report the result of survey of busy endoscopic spine surgeons regarding their usage pattern and any problems they perceive related to irrigation fluid. Ultimately, the author were interested in alerting and suspecting a novice endoscopic spine surgeon to the potential for sudden and unexpected severe intra and postoperative decline of neurological and cardiovascular function in patients with intradural spread of irrigation fluid, irrespective of whether a durotomy was encountered or not. This is the new publication, our team, and in 2024, this is a topic that we, in the conference, you're going to see more and more frequently because it's more than 1%. This is an example of a durotomy with massive lobes subarachnoid and basal cistern and with hydrocephalus. With the small durotomy, one irrigation pump, the pressure of the irrigation pump is a very serious topic to see. This is our case. We do this system to measure the pressure. And as you can see, the pressure is going down during the decompression, the endoscopic procedure. We have 12 patients who underwent L4 and 5 and L5S1. The hydrostatic epidural pressure ranged from 20 to 29 and average 24. The hydrostatic pressure delivery to the endoscopic by the gravity-assisted irrigation setup and irrigation tubing from a total height of 3.5 meters to the level of the patient and 1.2 meter, average 103 millimeters. Yeah, as you can see here, hydrostatic epidural pressure measured in patients who underwent this is around 24. And after the operation is dropped. This is an adverse event or complication relating to irrigation during lumbar spinal endoscopy reported by responding spine. You see headache, neck pain. This is advertence. If you are with local anesthesia, this is the reason I prefer local anesthesia. Most of the patient with local, with pump, you're gonna see neck pain, only a little bit of headache, and you have to stop the irrigation immediately. Sometimes it's for durotomy, sometimes too much pressure. If you don't stop, you get this seizure, neurological deficit, and in this way. And in the survive, You see the demographic data responding to spine surgery. You see Angola, Brazil, Canada, China, Colombia, Croatia, Ecuador, Germany, Mexico, South Korea, Thailand, United Kingdom, United States. The different, and this is the, what is your postgraduate training? Neurosurgeon, 16, orthopedic, 211. And what percentage of your practice documenting spine surgery? The percentage, you see, says 61 and 59 is around 30–40%. And hospital employed and private practice, most of them are hospital employed. And this is the adverse event and complications related to irrigation during lumbar spinal endoscopy reported. You see it's more than the doctors say. We have this a common complication. The headache is very common in the practice, and you must be warning with this symptom. Conclusion: in our study, suggest fluid headache, neck pain, seizures, and more severe complication, including autonomic dysreflexia with hypertension, may result from irrigation fluid entering the spinal canal or the dura sac. Our study established that unlimited irrigation at will should be avoided during lumbar spinal endoscopy. The endoscopic spinal surgeon should be prepared to manage unexpected neurological decline and cardiovascular compromise, mainly when encountering an incidental durotomy. Unrecognized durotomy may be more frequent and should be considered if the patient worsens after seemingly eventful endoscopic spine decompression surgery. This is very, very important to novice doctors, the durotomy and irrigations pump. My goal here is to promote always, if you can, you have a good anesthesia doctors, you do it with local and sedation. You prevent a lot of complication with this kind of durotomy and irrigation. Thank you.